Well, joining us now is Dr. 𝐏𝐬𝐲𝐡 𝐅𝐨𝐫, a consultant forensic psychiatrist who works with offenders and specialises in criminal cases. A very good evening to you. Thank you so much for joining us on the 9. We just heard the words of the judge there: no remorse, no mitigating factors. How do we begin to understand what causes somebody to do something like this?
Yeah, good evening. Thank you for having me on the show. Well, the truth is, I'm not sure that we'll ever get to the bottom of what Lucy Letby's motivations actually were, because she's not opened up. She's pleaded innocence the whole way through. But what we can do is we can eliminate some aspects like mental illness, like a history of trauma or abuse, as far as we know, in her childhood, like sexual gratification. When you take away those, what's left behind to me in terms of likely factors would be power and control. Jealousy for the families and the family units that she saw and she wanted to destroy, and simply a thrill in being part of the grieving process.
And why is it more unusual, perhaps, that you see female serial killers? We've heard that she's one of the most prolific, and also somebody within a healthcare setting as well that would harm people.
Sure. Well, it's a well-known fact that males commit far more violence in general, especially when the most extreme types of violence, so killing and serial killing. So a female serial killer is extremely rare. And there's usually a very strong history of trauma when in their cases. None of that applies to Lucy Letby. And I think that's one of the reasons why this is such a terrifying case, because externally there didn't seem to be anything wrong with her. You know, people thought she was a hardworking, competent nurse. There were no red flags earlier on. There were no warnings. So, you know, if she could do it, then potentially anybody can do it. That's the fear that the nation has.
And as you say, she pleaded not guilty. She has denied everything. So with that case, what do you do with somebody like that? Can they be rehabilitated? How is she likely to be dealt with in prison?
Sure. Well, if you look at it purely logically, not emotionally, there isn't really that much rationale in rehabilitating her, because she's on a whole life order. She will never be released back into society. So in terms of her mental health care, and I'm fully aware that many people watching this will probably think that she doesn't deserve any kind of health care, but the prison has a duty to keep her safe. And I think that the overriding concern is going to be her being attacked by other prisoners, because she will be a target. She will be low down in the hierarchy of the criminals in the prison, and also harm to herself. So I think the risk of suicide is going to be pretty high, especially in the first few weeks and months when she comes to terms with her future, her life imprisonment. So there'll be a high level of observation, and there will be safeguards to make sure that she does have access to observation, to mental health nurses, to a psychiatrist potentially, maybe even treatment like antidepressants.
She also didn't appear today for the sentencing, prompting the Justice Secretary to label her a coward. Is it likely that that is the case, that she didn't want to face those parents, those powerful impact statements, or could there be something else at play here? Is this perhaps somebody still trying to control the situation?
So I think you've hit the nail on the head. There's two possible options. One is that this is about dominance and control, and for Lucy Letby to try and exert the last semblance of power that she has. Personally, I don't think that's the case, and the reason is because she hasn't been smug or proud or indifferent or boastful during the trial. She's just been protesting her innocence the whole way through. So I think it's the other option. I think this is cowardice. This is that she knows that she's one of the most reviled and hated people in the country right now, and she doesn't want to continue the spectacle from her perspective. She's too scared to face the music, to go out there and have people point at her and insult her any further from her perspective.
And when we hear about serial killers, I wonder if you can just help us to understand some of what they think. As they harm people, do they become more emboldened as they appear to be getting away with it, if you like?
Sure. So there are lots of different motivations for serial killers. Some of it's related to trauma from their childhood, and they're projecting their anger onto their victims. Some of it's to do with mental illness. Some of it's to do with personality traits like a lack of empathy, like impulsivity. But oddly, Lucy Letby, I think, is quite unique because she doesn't fit into any of these categories. But to answer your question about being emboldened, absolutely. So Lucy Letby would have gotten away with it for so long, and even when concerns were raised, as we all know, the hospital management didn't take it seriously. So I think that would have emboldened her. She would have had very little reason to stop her actions, and she would have got a threshold. She would have built a tolerance. So the threshold to get that kind of thrill from ending a baby's life would have increased, so she would have needed to continue doing it to chase that high.
Dr. Das, thank you for coming on tonight and talking about such a difficult subject. Thank you very much for your time.